Well, hello everyone, and I want to thank Jovita very much for her awesome presentation. Understanding the HIA is definitely not an easy thing. It's only like a mere 2,500 page boring document that has very few sentences or partial sentences relating to opportunities to cover home repairs and weatherization for the network. So it's a lot of interpretation, and most of the state contacts and Medicaid, Medicare are not even aware of what's in the act. So we've got some serious problems going forward, which brings me to my presentation. So what we're talking about, the title of this is Moving Community Action and Weatherization Forward, Designs for Weatherization and Health Partnerships. Before I really get into the meat of the presentation, I want to make sure this is just kind of a short agenda of what I want to cover. Pretty much, what organization am I affiliated with, basic weatherization program delivery that we see across the country. What are these home repair programs we keep mentioning, and how does it relate to existing weatherization programs? And then a new model that we have put together called the STAND model, because we're doing fall prevention, so we came up with an acronym that was STAND. So that's what we submitted for a recent federal grant. We're ready for the next slide. We'll get into all these great things. So the first thing about who OPE is, we are a member-based organization that represents the weatherization providers throughout Ohio. The majority of the weatherization providers in Ohio, roughly probably 95%, are affiliated with community action agencies. So the point of why I want to make sure everyone knows what our group looks like is because we are able to offer statewide coverage. Now that is a key in terms of being able to provide service delivery on the healthcare side and to get grants. You need that ability to provide the statewide coverage. All right, the other thing that OPE does is that we actually work with, not only do we use HWAP funds, are able to work with HWAP funds, but we also negotiate directly with all of the utilities across the state of Ohio. So that includes electric and gas. And through their low-income weatherization programs or energy efficiency programs, we can combine and leverage our dollars. So that's the biggest key of trying to get our program delivery out. So we're able to take our HWAP dollars, we can take our LIHEAP dollars, we can take the utility dollars, and we can combine our programs to optimize what it is we're able to do in a home. And in some of these cases, we can move to the next slide, there are actual dollars set aside for health and safety. Typically, we have it set at 15% of the program spend. Now, what does that health and safety mean? I'm not really sure. There's really no standardization about the real health and safety. We have home repair programs in each of our agencies. We have over 60 agencies, and not all of them have a home repair program. And if they do have a home repair program, there's no consistency again of what they do. So that's a major gap in current service delivery in our weatherization network. It's a lack of standardization of program design. So now, this slide here talks about what is the typical program model we see on the weatherization side. This is on the electric side. That's why it says electric efficiency program model. So even with what typical weatherization model on the gas side, it's going to cover the same thing, except it will have an audit and shell measures. So what I want to point out here is we have the basic measures, which everyone's aware of. There are light bulbs, Energy Star appliances, hot water rafts. Then we get into shell measures. So only if they're all electric will they get the shell measures, unless this is being run from a gas utility. Here's where we see health and safety. And typically what we use for health and safety dollars is we want to avoid walkaways. That's where the health and safety comes in. Because this is where we can upgrade our electric, or the knob and tube electric wires in older homes. We can fix roofs, replace roofs. There's also mold and moisture issues that, actually do lead to asthma triggers, which Ravita mentioned, because mold and asthma is where tons of dollars are. We just have to be able to break into that network, and we're not there yet. Now, I have on here school education kits. The reason why they're on here is that there is an opportunity through the utility programs to get your message out through education kits. These education kits can be catered for home repair or fall prevention. They can be asthma. but it is an outreach marketing opportunity that can be taken advantage of in many programs. And there are private foundations that are more than happy to give dollars to create these really cool kits that go to elementary schools that then get to the parents' hands. So we're all ready for the next slide. Now, I wanted to point out that the existing weatherization program delivery, and I'm somehow skipped a slide, how it's connected to preventive health. Now, there's a lot of problems when we talk about these connections because the health world does not understand the weatherization world. The weatherization world does understand health service delivery, but the health world, unfortunately, kind of thinks, oh, weatherization, what on earth could they know? There are a bunch of contractors that fix things, and they're dirty. You know, it's a stereotype. It's not good, but we have to break through those stereotypes and prove why is the weatherization network useful? Why is community action useful? And all of that has to do with who do we serve? We have a massive population client base that we serve, that we are welcome into homes. Health providers are not welcome into anyone's home for the most part. But when the weatherization comes in, you know, you're getting stuff. You're getting appliances, you're getting cheaper bills. It's a welcome service. And there's also plenty of training that goes on the weatherization side. So having a simple education training for how to deal with seniors or how to talk to people about falls in their homes. That's something that the health world does not necessarily have. Now, here's my favorite side of the health world. They're actually paying the health world to their health practitioners to figure out how to install grab bars, how to do walkthrough assessments, and how to look at the health and safety of a house. Now, I don't understand why anyone on the health side that is trained in health service delivery should truly be doing this. Why is weatherization not doing this? Because this is an inefficiency of resource or service delivery. So from our view, it is kind of our job to figure out how do we talk to the health world? How do we create opportunities for engagement? And that's really what this whole entire talk is about. So it's not really that long. That's the good thing. And what I wanted to point out here about community action agencies is there's inherent kind of strategic opportunities or programs that are already going on. Community action agencies house a lot of services. Weatherization is one. Head Start's another. They will also have, sometimes they'll have health clinics. For our agencies, I'd say 85% have existing relationships with their local public health department. Now, Jovita did mention the health impact assessments. People that are currently doing your health impact assessments, it's not the weatherization side, it's your public health department. So you have to get in with the health department to get written into a health impact assessment. And that's key, and we'll come back to that in a little bit further on this presentation. The other piece of the service delivery that Community Action already houses, they already interact with children. Head Start, so if you're trying to get into asthma, Head Start, any place that caters to kids and caters to elderly, senior programs, Meals on Wheels. These are huge opportunities.
What slide should we be on?
I have no idea.
It has a number on it in the bottom right.
6. All right, so home repair programs and fall prevention. These home repair programs that we typically do right now, okay, so we talked about the roof, but there's other things we do if we have extra dollars. So that might be stair repair, banister repair, debris removal, grab bars, we'll put in some extra lighting, or even just putting in new light bulbs or burned out light bulbs can prevent a fall. Ramps, and this is interesting because Medicaid will pay for ramps if you get qualified. If your client is qualified for Medicaid, you can get your ramp fully reimbursed. And there's already customer education that our agencies do in terms of low cost or no cost ways to reduce their energy. We can also do the same thing with fall prevention. So we are already doing what needs to be done. In the home repair program, we are doing fall prevention. It has not been contained and communicated as such. So there's this big problem of communication, because we talk the language and the health side talks the language, and not necessarily, it's almost like they don't overlap, but they do. It's just a matter of how you choose your vocabulary. So this is interesting because if you want to have a fall prevention program, you have to be able to tell a story. You have to sell your program. So here's our story that we created. In Ohio, 140,000 individuals turn 60 every year. Now, who falls? Those above 60. Falls among elderly are a primary cause of hospitalization and placement in long-term care facilities and premature death. Now that impacts the healthcare cost world. So if we're able to reduce the spending or the health outlays, that gives us serious dollars to sell ourselves. Because when we look at kilowatt hour savings on the energy side and look at the dollars avoided on the energy side, they are so small compared to health savings from avoiding a fall or avoiding premature entry into long-term care. Falls cause early admittance to long-term care. Unsafe homes cause early admittance to long-term care. And long-term care averages $33,000 per person per year. And that's the cheap side. So we see that falls and falls-related injuries cost Ohio more than $4.2 billion each year. And of the 173,000 Ohioans who need long-term care, that accounts for 7% of Medicaid enrollment. But on the other hand, we're talking 41% of the actual program spending spent on long-term care for only 7% of the population we serve.
Is it in billion at the bottom?
That is the 173,000 Ohioans. What billion are you talking about? I haven't gotten to the last one. The long-term care consumes 1/3 of all Medicaid spending. $4.85 billion that's an Ohio number. And that is from 2009. There are website references on this presentation, so they should work. Click on them and they will take you to more info, but each state has stats like this. It's not very hard to find, just Google. Where's my next one? Yes.
You're just doing the repair work?
We're doing pretty much.
Okay. What about anything as far as exercise?
Can you repeat the question, please?
All right, the question was asked if for the program, if we are doing just repair work. And I need to clarify something. We have just put together a proposal and submitted the proposal to the feds. So we do not have this program in place. We are shopping the program I am discussing with private foundations, and we are applying for grants across. Whoever wants to give us a grant, we're applying for it. These federal grants do want actual movement programs and coordination, but this is where we connect our resources with the health. So if we can get a referral system, and if someone goes into the hospital for a fall, they should be able to get referred to weatherization. Weatherization goes out, deals with the house and a home assessment, and it can work vice versa. So if we are in a home with someone that is older, we can actually just do a fall prevention and refer to the health service delivery. That way they're able to connect to some of the evidence-based programs, because that is a key in getting funded. So that's matter of balance, Tai Chi, all those things. Then there's yet a third level of link. That link is your community action agency. The senior programs offered then can actually offer those programs and receive funding. It makes the grant more, palatable. And if you're able to have, if you have existing senior programs, it's not really having to hire anyone. So you're just able to kind of optimize some resources. So this is, I pasted this in from someplace, that the passage of the Affordable Care Act has an unprecedented funding to address health. And what they're looking at is they want cross-cutting ways, they want community-based ways, they want partnerships. Those are keywords that they are looking for. And some of the resources that the Affordable Care Act actually has in it, I'm not really sure if that's the Affordable Care Act, but these are actual national things. National Prevention and Health Promotion Strategy. The Prevention and Public Health Fund is definitely part of the Affordable Care Act, and that fund has $12 billion in it. So the way that you access that fund is through HIAs. There are also grant opportunities. They will have solicitations. We applied for one of these grants.
HIA, Health Impact Assessment.
Yes, absolutely.
Repeat it.
The HIA is Health Impact Assessment. But again, weatherization is not the one that is truly writing the public health impact assessments. It's your local health departments. And the IRS code actually requires nonprofit hospitals to file an HIA
every 3 years. So if you can get written into an HIA, that means you can get your program justified.
Is it HIA or CNA?
I think they're the same thing. Community health needs assessment, and the other one is health impact assessment. So the CHNA is the one that is required, is the IRS. And I thought they were the same. Okay, so they're not the same. We'll talk about that later. This is just a report to Congress that says that there's evidence gaps for clinical preventive services. The health side has a serious problem with service delivery in in-home settings and reaching folks that live in rural areas that are not in urban areas that, I mean, it's a problem getting into people's homes. And one of the 5 key areas that was recognized was preventing falls and fractures. So there's another piece of justification in any type of program you're looking for. Here are some other resources with some web links you can look up. The National Council on Aging has been the most active in putting out information. They have the Falls Free Initiative, and several states are members of this Fall Free Initiative. Ohio actually has Ohio Elderly Falls Coalition, and I think it's one of 13 or more states that have a statewide fall prevention network. There's a state policy toolkit here for advancing fall prevention resources. Here's the Medicare and reimbursement for falls-related services. Currently with Medicare, some falls prevention is in fact reimbursable. The problem is you have to make sure that your client is qualified, and you need to, so working with the state Medicare office is very important. The CDC Compendium of Effective Fall Interventions is simply a list of recognized evidence-based programs that you can use for reference or program design. Because with funding, the health side wants evidence-based. And evidence-based does not mean you are responsible for proving your success. It means you use something that has been tried and proven true. So the example model we put together, we called it the STAND, which means Standard Training and Network Delivery Model, because we're creating standardization. If we want Medicare to pay for something or Medicaid to pay for something, standardization is going to be a key component, especially if we want this, because another key word is replicable. You want your programs replicable, not just in a local area, but maybe from state to state. The Weatherization Network has an ability to provide training and standardization across the country. So that's something that we all need to keep in mind. Now, the program that we've put together, I've listed the partners that we have. One side shows the weatherization, the other side shows the health. So we have area agencies on aging, county health departments, community more aging, Ohio Department of Aging, the Ohio Department of Health, the statewide Falls Coalition, and I put AARP under health because they do deal with a lot of health issues because they're a huge advocate on the insurance side. Now the weatherization side, these are some of our members that are all community action agency members. So what we will be doing is it will be OPE, because we're kind of the central lead that coordinates everyone, that will be hand-holding people's relationships. So we will manage the relationships at the local level and the state level and introduce each other and create some type of standardized referral process that can be implemented across the state. We're also integrating evidence-based programs, which is Matter of Balance and Steady Toolkit. We'll be doing this through a referral network, as well as any of the community action agencies that have existing senior programs. We will have them trained and master trainers from Matter of Balance and see if we can offer those courses. I'm running out of time. The other piece here that we've done is we will be working on creating a standardized home hazard intake assessment. So in Ohio, the Falls Coalition has a home hazard intake assessment. The CDC has a home hazard intake assessment. Our agencies have home hazard assessments. Everyone has assessment. So we're going to sit in a room and everyone's going to put their paper together. We're going to try to come up with one. Because we don't have one, and that's a serious problem. You want programs to be reimbursed. Client education. I want to put together a cute little kit for falls prevention. You know, We know it's not that hard to tell people, here's a piece of carpet that is in the way, it needs to be removed. But what about light bulbs? Light bulbs are effective fall prevention strategies because if you can't see, you might fall. Grappling bars are another piece. So coordinated program delivery is the other piece because the biggest component we could see that the feds were looking for, when I say the feds, it was Department of Health and Human Services. It's called ACL, so I think that's Administration Community Living. It's who we applied for, and they really want to have the replicability, and they want statewide program delivery. And in order to get that program delivery, you have to have the network partnerships, because the health world, again, does not know what the weatherization world does. And the weatherization world needs to kind of add a little bit of training for the proper communication to talk to clients of faults. And eventually we hope to move this to an asthma model, because asthma is where the dollars are. Asthma is for children. That's any program you target with asthma really has to be geared towards kids. But weatherization can be fully reimbursed for asthma as an asthma mitigation. In order to do that, you have to make sure you can tell the story, document there are several programs in the country, I shouldn't say several, but at least 5, that have proven weatherization is in fact a viable opportunity or a strategy to get to help with reduction in asthma triggers, because asthma is a huge strain on the health system. Now, why do we talk about asthma? Because the weatherization or the WAP network uses the house as a system approach. So that's part of your blower door test, and actually testing what your air changes per minute are, and then making sure you have proper ventilation. Because if you don't have proper ventilation, that's a trigger to the house. If you don't have proper insulation, you have leaks. That's another trigger for asthma. So that's what this slide is really all about. If you're too tight, condensation, mold, poor air quality, asthma trigger. Too leaky, you wind up with asthma, you wind up with sickness, and then that's relevant for elderly as well. It's kind of like everyone in between, the young and the old is kind of left out, but there's usually someone in the house that is one or the other. So here's your stack effect. Most folks are familiar with this, that the stack effect is equal to the air in, is equal to the air out, and that is also equal to your air movement. So anything that's coming in affects what's in, and if it's not vented properly, you will have more problems. So what do we do from here? It's leverage, leverage, leverage. So we have our utility programs, we have low-income weatherization programs, there's city and county resources, there's foundations, and there are community-based models. Trying to tie all of those together is one of the strategies that, I mean, it's the primary strategy we're using, but there's a lot of variation in any type of deployment that says leverage, leverage, leverage. So create financing solutions. A lot of people this is where fee-for-service comes into play. We're developing a program that we can charge for those that do not qualify. We can create sliding fee scales for those that do not qualify. So there is opportunity going forward, and we need to move quickly because we're afraid that federal dollars for our weatherization programs are going to face greater and greater restrictions or cuts, however you want to look at it. So again, state Medicare, Medicaid offices are vital in terms of opening that dialogue. They might not know what you're trying to find out, but they are the people that you will have to work with. Local health departments are key in getting dollars to your organization in local areas, and they're pretty easy to work with too. State coalitions such as the falls prevention that we have in Ohio, the EPA asthma group is a great group that you can work with. Market the message, healthcare does not understand weatherization. Speaking engagements, that means that if there are health conferences, submit a presentation to talk about weatherization and health, because they need to hear the message. Identify funding sources. There are lots of funding sources out there. We have over 330 community foundations in Ohio. So those are not large foundations. Those are small foundations at the local level. And those are important. They are typically not taken advantage of. be able to talk about what the gaps in service delivery are, because there are substantial gaps, and one of those biggest barriers is health is not able to get into people's homes, and there's a misalignment of skills. So I don't think that the healthcare nurses should actually be trained on how to fix a house. That doesn't make sense because they're putting us out of work. And then make sure that you identify the potential cost savings. Any project that you give, try to look up the reduction on the strain of healthcare cost. And a one-page handout that you can hand to senators, because there are bills in every state that are dealing with healthcare expansion. You can create carve-outs for these programs, but you have to be working in the actual state house on this. So here are just some ideas of potential funding sources. Robert Wood Johnson Foundation is one of the most aggressive right now in fall prevention. The George Gunn Foundation, Dave Thomas Foundation. There's plenty of other foundations, but it is just a start. Community Health Needs Assessment. This is the CHNA. And I have here about the IRS. So this is for nonprofit hospitals, and the majority of hospitals are all nonprofit. Who does the CHNA? There are several universities that will be subcontracted out, but they are initiated through public health departments for the most part that I've seen. And managed care networks. These are my favorite. You can sell your business case to United Healthcare, Blue Cross Blue Shield, Cardinal Health. You don't have to worry about federal forms. So if you can prove to them that you're going to reduce their spending, you've got a pretty good case that they will give you money. And corporate giving programs. Don't ever forget that, AK Steel, any of your utility companies all have foundations. You can apply directly to the foundation and a utility, and then how good is it for the utility to be able to say, look at what we've been involved with. Banks all have foundations as well. Walmart and Lowe's, we haven't had all that great success with because everything's so local and you can't get any more than $1,500 from them. So if anyone can break that model, because they say they give a lot more, let me know, please. So thank you. Any questions? Yes.
I have a question.
Wait, how do we deal with the mic?
Oh, yeah, do you want to do it together? Sorry, I talk so fast. I was trying to get through.
Just use this and then.
He's talking to?
Yeah, just talk toward my back.
Okay. I 100% buy into whether there's Mike Handoff from BPI, I apologize. 100% buy into asthma weatherization. Obviously, there's a link there. You discussed it. You hit the main points, moisture being a specific one, but everything from insulation to duct sealing to everything and beyond. I get it. What I don't get is the immediate connection between weatherization and falls. A lot of the improvements that you make in the house to, combat falls, and I get, the medical implications and certainly the cost related. I get that, but if you're putting, grab bars in or ramps or upgrading lighting, and that's kind of like, the dark side of home performance, that's like the least you can do as far as home performance is concerned. So when I think of weatherization, I don't necessarily think of lighting, windows, etc. I think about, as you mentioned, house system, like huge elements. I don't see the connection between weatherization connections and helping prevent falls.
That's a great comment, actually, because you're right. Weatherization itself doesn't necessarily have anything to do with it. But because the weatherization that we have is based in the community action agencies, and there are dollars for health and safety that come on the federal side, and there are some state dollars that come in for health and safety.
No, you're okay. It's just.
We do, in fact, have existing providers, weatherization providers, that have carve-outs in their own programs for home repair, and then there's the health and safety. So that's part of, it depends on the provider if they already have something similar. So that's why we did this fall prevention, because our home repair programs and the health and safety already are addressing these pieces.
So it's not necessarily going into weatherization programs and trying to necessarily take from their general funding, but pieces of things that are set aside.
You're leveraging the capabilities in the weatherization world.
Okay.
That's really what it is, that people are already trained in how to do repairs. So it's a very small step to get a concentrated program together. Yeah, but you have a great point. So when communicating the message, I have to be careful about saying, weatherization programs, because that's that link with community action.
Right.
And what the existing programs are.
I mean, it makes a lot of sense. There's certainly a natural marriage there.
Yeah.
When I look at weatherization as far as asthma is concerned, I look at a lot of younger
Absolutely.
populations because I think about the kids.
Yep.
And that's the real sell. Your kids are getting sick because your house is not a safe environment for them. That's the sell.
Right.
Granted, elderly also have same issues with asthma, similar issues, I should say, with asthma and things like that. But as you just mentioned, when you're in the home, it's easier to make those sales.
Yeah.
To get that point.
And you have the access. The reason why we started with the fall prevention program is we wanted a route to make the relationships in health safe. That's truly why we did it. This is the easiest, quickest thing we could put together. Because where do we want to go? Well, obviously we want to go to the asthma side for weatherization, because that is really truly the best cost-benefit analysis argument you could possibly come up with. But we have to build that bridge and that linkage. And instead of asking for millions of dollars, we can ask for thousands of dollars.
Sure.